Now on Mississippi Insight, Mississippi's maternal mortality crisis, school choice, HBCU funding, and the future of PERS. What's next at the Capitol? We'll hear from State Representative Zakiya Summers on what lawmakers plan to do. Mississippi Insight starts right now. I'm Byron Brown. Thank you for joining us for this week's edition of Insight. From Mississippi's high maternity rate to school choice, HBCU funding, and the future of PERS, major issues are front and center at the Capitol. We're joined now by State Representative Zakiya Summers. Welcome to Mississippi Insight.
Thank you so much.
Mississippi consistently ranks among the worst states for maternal mortality, and especially for Black women. Talk about those rates and where we stand as far as in the state of Mississippi right now.
Yeah, sure. Mississippi, unfortunately, has one of the highest maternal mortality rates in the country. And when we dig a little deeper down into the data, it shows that Black women are disproportionately dying as a result of a pregnancy complication compared to our white counterparts. I believe it's at 86%. And so it's clear that we have an issue with maternal mortality and with access to maternal health. So what we've been doing in the legislature, back in October, the Mississippi Legislative Black Caucus held a legislative hearing. We brought together experts, advocates, families that have been impacted by this issue to hear exactly what's going on, and more importantly, what can we do to help address it. And as a result of that hearing, we've put together a package of maternal health legislation. The highlight of that package is what's called the Mississippi Maternal Health Momnibus Act. And so the Momnibus Act is a comprehensive set of policies that addresses doula care, lactation support, grants for community-based organizations. Where can we identify these maternal health deserts exist? How do we approach that? What are the recommendations that determine how we can help to provide greater access to moms? What can we do in terms of transportation barriers, childcare, codifying nutrition as an important part of that, providing self-monitoring blood pressures that are covered by Medicaid and private insurance?
Is there a problem based on where people are living, their zip code? Or, for example, if you live in Jackson or if you live in Madison or Rankin County, is it different than if you live in the Delta?
Yeah, absolutely, because the access to care is different based on the region that you live in. Fortunately, in Jackson, we have access to hospitals, clinics, healthcare professionals in close proximity. But if you live somewhere in the Mississippi Delta, it may take you an hour or more to get to the closest clinic. So we're seeing issues when it comes to prenatal care, just ensuring that mothers have everything that they need to have a healthy pregnancy, the actual birthing process, and even postpartum. That was the other thing I was trying to think about. We also have within that Momnibus Act that maternal mental health screenings would also be covered by Medicaid and by private insurance. And the reason why that's important is because we received information from the Mississippi Maternal Mortality Review Committee that showed that a lot of these women are dealing with postpartum depression, which could lead to, an adverse impact following the pregnancy of their child, or could even lead to, unfortunately, some instances of infant mortality. And so we are trying to be as proactive as we possibly can to ensure that these women have what they need. What we say is we want mothers to not only survive pregnancy, but we want them to thrive in motherhood. And that's for all moms. We know that there's a disproportionate area for Black mothers, but we want all women and all babies to be healthy here in the state of Mississippi.
So there's a lack of insurance and there's a lack of access to care. Is it basically the bottom line here?
Well, the MMRC report actually showed that most of these women are covered by Medicaid. Now, you'll recall over the last couple of years, we have provided through legislation presumptive eligibility. So it presumes that a woman is eligible for Medicaid. That helps her to get into care early without worrying about what the cost is. And then we also extended postpartum coverage for a year. And so these women have access to insurance, but it's the access and sometimes it is the affordability, because there are some services that are not covered by those those carriers.
So how do we increase the access to care? What's the state doing, or how do they get more care in those communities?
So, and that's what we're doing with this Momnibus Act. So again, it is a comprehensive set of policies where the Department of Medicaid, the Department of Health are working together to determine exactly what can be provided and what can be covered. And it's going to carry a cost, but we say that no life should be lost as a result of how much it's going to cost. We need to make sure that we're doing what we can to save these moms and save these babies.
Is it a recruitment of finding doctors and nurses that will work in those communities?
Absolutely. We have critical shortage areas across the state. As part of the maternal health package, we also came up with some legislation that would create a pipeline for maternal health workers starting in high school. What we learn from doctors is that oftentimes there are students that want to enter into the field of medicine, but they haven't done the work necessary, they haven't taken the classes or done the assessments in order to successfully apply for medical school. And so we want to clear that gap, provide that direct pipeline where we're recruiting students in as early as high school and getting them prepared to enter into medical school. And then we also have another piece of legislation that would strengthen that pathway from HBCUs into the field of medicine. We know that patients are going to feel more comfortable with healthcare professionals that come from their community. So they need some competency, they need some familiarity in the healthcare field. And so we want to prepare students from our HBCUs, Jackson State University, Alcorn State University, Valley State, Tougaloo, even Rust, to prepare them to be able to enter into the field by giving them the mentorship and the assistance so that they can do so.
And does it look like there's some promise there, that we're seeing some progress in those areas?
I think we're still having some conversations. I'm looking forward to having some additional meetings with the leadership from the Public Health Committee over the next couple of days to see if there's something that we can push through the process. We know it's a heavy lift, but we're going to continue to work on it.
Talking about education here, there's in the Senate, in the House, both of you guys are talking about school choice. Supporters of school choice say it gives parents more options, with critics arguing it takes money away from the public schools. House has a plan, Senate also has a plan. The House passed a plan that would give choice to any school, public and private.
Correct.
Where do you stand on the issue of school choice?
So I'm a public school product. I am a proud graduate of Jim Hill High School. I say it's the best high school in the city of Jackson. I have 3 sons that are in public schools. I am a public school advocate, and I think anything that would take away funding from public schools actually helps to dismantle public education. So I am on the side of, let's make sure we're equitably funding our public schools. We don't need to create another system where people of means would take advantage of a private school tuition or what they call school choice. Now, I know people hear school choice and they say, parents should be able to make the best decisions for their children. And I absolutely agree with that. But it shouldn't come at the cost of those public schools. And so I'm very concerned that with House Bill 2, and I'm hopeful that the Senate will stand firm and not push House Bill 2 through, but I think it's very dangerous for the state of Mississippi. We've seen school choice take place in other states. We've seen where families that are already in private schools end up being the ones that take advantage of the vouchers. In addition to that, it balloons state budgets. Mississippi is not in a position to even afford school choice. Just last year, we eliminated the income tax. We've seen a reduction in our revenue already. We're not going to be able to afford the high cost of school choice. And Byron, we really have not seen what fully funding education looks like in a sustainable way. We know that when we had MAEP, we fully funded education twice in its inception. Recently, we created a new funding formula where we have fully funded that over the last couple of years, but let's see how that goes. And then the last thing I'll say about this, our schools are doing a fantastic job, and that's on the backs of our teachers, on the backs of our families, communities, all working together to ensure that our students are successful. We're in an upward trend. I believe we're 16th in the nation. We might be 9th in reading, if I'm not mistaken. And so we don't need to reverse that trend by throwing in a wrench in how we fund these schools and providing school choice.
If schools are doing so well, and we've seen that because we've gotten a lot of national recognition for how our public schools are doing.
Right, the Mississippi Miracle, they call it.
Why is there such a push about choice if the public schools have made so much progress?
Well, I believe that my colleagues from across the aisle and the leadership feel like they have a mandate from Washington, D.C. to implement school choice in the state of Mississippi. This is not a decision that's come from the ground up. None of my constituents, and I can't tell you how many calls, emails, letters, text messages, social media messages that I've received that say we are not for school choice. And I think that was also evidenced by the vote that we saw in the House. Not only did we have full opposition from the Democrats on House Bill 2, we even had 17 Republicans to join us. And so this is something that obviously is a controversial issue that a lot of people don't want to see. But I feel like, you know, our colleagues feel like President Trump is telling them this is something that you need to do. And instead of us focusing on what's going to be best for Mississippi, we're focusing on what's going to be best for Washington, D.C. to have influence over Mississippi. And I think that's the wrong direction for us.
The Senate version would give choice between public school to public school. Mm-hmm. Is that a better option, or should that not even be on the table as well?
Well, you know, I have contemplated what we call portability. And what the Senate's version would do is if you're a student in a public school and you want to go to a neighboring school district, then your home school would not have to give permission. Only the school district that you want to enter into would give approval for you to transfer into that school district. I also think that that is bad for our public schools, because effectively what you're doing is you're taking money away from that school district because the money is going to follow the child. Mm-hmm. And so, say for example, in Jackson Public Schools, we have an exodus of children that leaves Jackson Public Schools and goes to a neighboring school district. That money is going to follow them. Well, the JPS has already budgeted for utilities. They've already budgeted for water, how much they're going to pay their administrators, their teachers, their cafeteria workers, their school bus drivers. And so those costs still remain where funding still leaves, and it's going to put the existing school district in a bad position.
There's also been talk about how that it would come with maybe recruiting athletes that way. Is there concern of that too? Absolutely.
And the other thing about this portability issue, and even with the school choice issue, the schools would determine who they want to accept. So they can deny a student, and what we're concerned about is that they're going to go after the best, the brightest, or even the athletes in order to make their schools better. We should take the position of making sure that all of our schools are successful. We keep talking about and hearing about this brain drain issue. We want Mississippi to be the best place to raise a family, right? And so we need to ensure that our school districts, because they truly are the backbones of our community, to ensure that they're set up for success.
Where do you see school choice when the session comes to an end? Is there going to be a school choice on the table, or a bill that's finalized, or what do you see that's playing out by the time the session ends?
If I had an 8-ball, I would be able to give you a good answer to that. I don't know. There's still a lot of conversation behind it. As you know, this is run by politics, mm-hmm. and oftentimes politics will get in the way of some legislation. If the House and the Senate cannot come to an agreement, things will get stalled. So I'm not quite sure, but I will say again that I'm hopeful that the Senate, as they have publicly said through the Senate Education Chairman, that they're going to stand firm and say, this is the only thing that we will support. We will not support a full school choice package.
Staying on the subject of education, specifically in Mississippi here, currently there's higher education funding formula is putting HBCUs at risk. And do you believe it was designed in a way that disadvantages these institutions?
So here's what's happening within that conversation. Well, two things that I want to highlight. One is we had a bill that would consolidate the administration for community colleges. There was a lot of concern around that bill. Fortunately, for now, that bill is dead. Now, we always say a bill is never dead until sine die, but for now, that bill is dead, so that's a good thing. On the HBCU funding, there was a joint committee hearing held a few months ago to discuss the possibility of changing the funding formula for IHL into a performance-based budgeting formula or an outcomes-based funding formula. Now, we've seen this take place in states like Tennessee, and what we've seen is that it's had a negative impact on our HBCUs. What is available right now is a Senate bill that's going through universities and colleges that would create a study committee The study committee will be responsible for coming forward with recommendations to the full legislature on if this is something that's possible, and if it is possible, these are the things that should be included in it. I think at the end of the day, what this really is about is providing more funding to certain universities, and it's putting our HBCUs at risk. We have to remember that historically our HBCUs have been underfunded. We see deferred maintenance. They come to the legislature every session asking for appropriations to help with certain issues that we don't see happening at our, say, Ole Miss or Mississippi State. In addition to that, the students that go to the HBCUs are what you may consider at-risk students. Many of them are Pell Grant students. They have transportation issues. They have other circumstances that impact whether or not they graduate within 4 years. And so I think there's a lot that we need to study and discuss. If there were to be a performance-based budgeting formula that comes forward from this committee, we have to be clear that it needs to be rooted in equity to ensure that the HBCUs are getting their fair share, not at a detriment due to more funding going to the University of Mississippi or Mississippi State University. And I say that not in a negative way. I want to see all of our universities thrive, but certainly not at the cost of HBCUs.
Are they listening at the Capitol to this argument here?
I believe so. I've spoken with the chair and the vice chair of the Universities and Colleges Committee in the House. They certainly don't have an appetite for this bill, but of course it has to go through the process. It hasn't come out of the Senate yet, so we'll see what happens.
Those who attend HBCUs here in Mississippi, how concerned should they be about what's being talked about at the Capitol? The
alumni and students of these HBCUs are totally engaged. Earlier in January, we held a large town hall at Mount Nebo. We had 500 people in person and online attending this town hall, and we just laid it straight. This is what we're dealing with, this is what we're hearing, this is what we're up against, and this is why you need to be engaged. And so folks are becoming educated, they're ready to take action at any moment's notice, and we have to continue to communicate with them and let them know what's happening. So if that moment strikes, we'll be ready.
Because if there were cuts, it's a possibility that one of the schools could close.
So that is a potential outcome of legislation that would change the funding formula, and it appears that the target is on Mississippi Valley State because their graduation rate is, I believe, about 29%. But again, they have students that have certain circumstances, and it may take them 6 years to graduate from a university because they may have gone to a community college for 2 years, or they may have other issues that impact when life is lifing, right? And so that's why I said those equities, those weight equities need to be implemented if the funding formula were to be changed.
I was talking about retirees and PERS. There's always been talk about, is there enough money to keep PERS operating at the level that it's operating? Where do we stand as far as PERS and shoring up PERS?
So PERS, unfortunately, is dealing with a $26 billion unfunded mandate, okay? And so they certainly need more money. But what we did in House Bill 1 last year when we eliminated the income tax, we created a new Tier 5. The Tier 5 is totally different from where I am as a Tier 4 or prior to the Tier 4 status. What Tier 5 says is any new hire that comes in after March of this year, they don't receive a COLA, they don't receive an employer match, they receive whatever they put in their employee benefits plus something like a 401k plan, which means that they're not going to have the amount of money that a Tier 4, Tier 3, et cetera would have once they retire. This puts particularly our education system and our public safety system at risk. Educators, police officers, firemen, public safety personnel are already telling us that it's hard to recruit and retain those employees. When you come into those positions, you're not necessarily coming into those positions because of the salary. We know the salary is not fair, but you're counting on your retirement after you finish your service. Well, this new Tier 5 says, look, it's going to make it totally difficult for you to be able to recruit and retain employees. So what we've been working on is that we need to repeal Tier 5. We have a bill in the Senate from Senator Blunt that does that, and I fully support that. But in addition to that, we need to give some funding, some direct funding into PERS. The Senate passed a bill, I believe it was during the first week of session, that would provide $50 million over the next 10 years. So that's going to help a lot. But we have to do something with this Tier 5. You know, we hear from leadership. We want Mississippi to be able to attract industry. We want to bring in employers. We want to have a strong workforce. Well, in order for us to have a strong workforce, we got to have a strong retirement system. And in fact, Mississippi's retirement system over a number of years has been, you know, one of the best in the country. This Tier 5 hurts that.
Mm-hmm. How do you see that changing? I mean, is everyone in agreement that Tier 5 something has to change with Tier 5, or is it a minority of people who think, okay, we got to make a change?
I tell you, many of my colleagues are hearing from folks back home, from police officers to sheriff deputies to teachers, who are very concerned about this Tier 5. And so it is a hot topic. It is a priority issue. Even the speaker has talked about the need for us to do something with PERS. I don't know what's gonna come out. I know that we need to put some money in there, and I'm hopeful that we can repeal this Tier 5.
Sounds good.
Yeah.
Representative Zakiya Summers, thank you for
so
joining
much.
us.
Thank
Good
you.
conversation. And we'll be right back. If you have comments or questions about today's show or suggestions for an interview or segment, just drop us a line. Email our producers. The address is news@WJTV.com. Big thanks to Representative Zakiya Summers for joining us this week. We'll be back next weekend with more of the political and current affairs coverage that you demand. I'm Byron Brown from all of us here at 12 News. Make it a great weekend.